Okay, we can start with the introduction.
Meeting is being recorded.
Once again, good morning, good afternoon, good evening, depending on the time you are attending this very important event, the new AIU Symposium on Innovative Ideas. Pretty much like we've been saying a short while ago, innovative ideas are about the new way, the new procedures, the new paradigms that we are supposed to apply, because the new generations can certainly not accommodate the old ways, the old manners, the old systems. So our presenters during this potentially important educational event will be portraying that concept with whatever they have at their disposals, their text, their PowerPoint slides, and whatever they have. It is our hope that those presenters will be performing outstandingly well to again explain to the attendees what it is about to have innovative ideas and to promote them in every aspect or sphere of life. So we have Dr. Boureima Kabore from Burkina Faso. I understand that Dr. Kabore is ready. And again, I wish everybody to enjoy this event. Welcome, everybody. And so let's get with Dr. Boureima Kabore, who is a doctor in public health, our first presenter for this AIU Symposium, Innovative Ideas. Thank you again, everybody, for joining us for this event. Dr.
Boureima Kabore, if I see you have your camera on, but we don't see you, but can you talk?
Yes. Can you see me now? Can you see me now?
No, we actually cannot see you, but we can hear you.
Okay.
Can you see your screen?
Two devices.
So if I bring up your presentation, can you start your presentation?
Yes, we can start now.
Okay. All right, go ahead.
Dr. Kabore, your presentation is now up on the screen. You may go ahead and begin your presentation at this time, even if, unfortunately, we cannot see you. Your camera is also off.
Well, can you see me now?
No, actually, we cannot see you. Yet. We saw you before. We saw you a few minutes ago.
Okay, I will stop one device.
Okay, that's probably the problem. If you have two devices on, so the system is getting confused as to which camera to focus on. So make sure you only have one that is launched so the signal can get into us.
Hello?
Not yet.
Well, go ahead and start talking for your presentation.
So and can you see me now?
No, we cannot. Not yet.
If you cannot see yourself on the screen, Dr. Kabore, we cannot see you either.
Yeah. Can you see me? No, not yet.
Not yet. But go ahead and start. Can you see your presentation on the screen?
Okay. Thank you very much, Dr. Valfin. Thank you very much, Dr. Lambert. Thank you very much, everyone. I am Boureima Kabore, a doctor of public health from Burkina Faso in West Africa. I defended my thesis of doctorate in public health at AIU in last December. December 2021. And that is an opportunity for me thank very much Dr. Lambert, Dr. Freddy, to thank also Liliana and all AIU staff members who supported me during the courses. And once again, thank you very much AIU for the opportunity given to us to think innovation, to share our innovative ideas, and to receive suggestions and recommendation for AIU community members in order to improve our idea to make them fruitful. Now, my innovative idea is how to match public health, public, private, and community initiatives to contribute to sustainable development goals. More often in low-income countries. Slide.
One second, I'm getting there. There we go.
Okay. The content of my communication will step like this. After a short introduction, I will show the context of my idea, the goals, the strategies, the objectives and actions, opportunities, challenges, and report on action what have been done so far. And I will end by a short conclusion. Slide, please. As an introduction, I would say that I stopped my education after the baccalaureate to find a job, as my parents could not support my education fees. And then I have been enrolled by the government of Burkina Faso in 1994 to be trained as a nurse to serve at rural area, and this for 11 years. I loved what I was doing, but I noticed that I had to improve my education, and that was something like a must for me. I started with short courses and grew from baccalaureate to baccalaureate level to bachelor and to master. And also thanks to AIU, I stepped up to doctorate level. So with my doctorate degree in hand, I would say that that was a fulfillment of my greatest dream so far. Slides. But at professional level, I think there was something else to do. Indeed, being an employee is a good thing, as you just need to be here and to do what you are requested to do. But when you think deeply, you see you are limited in terms of innovation because you cannot innovate what is not requested from you, and also in terms of profit, you don't profit from your work. That is why I left the government in 2012 to work with a national civil society organization founded by international organizations such as like the Global Fund. And with my training at AIU, I discovered that I can do more than working at NGO level in terms of innovation, in terms of impact, but also in terms of impact, income for me and for my family. Slide, please. The context of my idea is that one. When I see from the global vision, it has been shown that the number of people living below 1.19 US dollar a day was forecasting to decrease from 741 million of people in 2015 to 588 million in 2021. But with the COVID-19 pandemic, we can see the decrease was real from 2015 to 2019. But from 2019 to 2021, as you can see on the graph, the number of people living with that amount is increased from 645 in 2019 to 751 in 2021. That means that COVID-19 has worsened the poverty, particularly in low and middle income countries, including in Africa. So when we consider the coverage of COVID-19 vaccines, we can notice that the lowest COVID-19 vaccine coverage is registered in Africa, where we are less than it is around 2% of people in Africa have been vaccinated with that vaccine. When in Europe it was about 68%. That situation have been set in 17 June 2021. Slide. So here we can see the coverage or universal health coverage service in the world. Here we can see Sub-Saharan Africa has the lowest coverage of universal health coverage in coverage with Oceania. Yes. So that means that there is a gap of universal health coverage which is a tool to reach sustainable development goal by 2030. Also, at the graph below, we can see the HIV prevalence in the world. We can see most of the highest prevalence of HIV is registered in Africa. Slide. Here, this graph shown the mortality, the maternal mortality rate in the world. Here we can see the highest, except in Afghanistan, the highest ratio of mortality is registered in Africa. And also, here we can see the lowest prevalence of modern contraceptives is also registered in Africa. Means that women will have the children they don't need. So slides. In terms of education, we also see the lowest rate of completion of secondary school is registered in sub-Saharan Africa. And also, when we consider in sub-Saharan Africa, we say that there is also different disparity between girls and boys. Slide. With that context, what are our goals? Our goals through this initiative is to contribute to sustainable development goals. And we will see with the first goal, which is no poverty, we will contribute to fight against COVID-19 pandemic and its impact on people's life. The third goal, which is good health and well-being, will contribute to maternal and child health improvement, will contribute to immunization coverage all ages to increase. We will contribute to reduce the impact of communicable and non-communicable diseases. We'll contribute at the fourth goal, which is equity education, to improve the right for sexual and reproductive health for adolescents and young girls at school, because pregnant is something which leads some girls to stop their education. Will also contribute to the goal 5, the goal 5, which is reduce inequities by contributing to ensure equitable access and gender mainstreaming in each program design, implementing, and evaluation. Slides. Will also contribute to the goal 6, which is clean water and sanitation. We will contribute to raise awareness on clean water and sanitation. And the last one, which is decent work and academic and economic growth, will contribute to employ people using our organization, and also to contribute to economic growth. So by here we can see, here is the 17 Sustainable Development Goals, and our initiative to reach six of them. So that is what we have declined in the previous slides. Slides, please. What are the strategies we'll use? The strategy we'll use is, I consider pillars. And here you can see there are 4 pillars. Our initiative will cover the business. When I say business, when I'm talking about for-profit organization, I say no-profit organization is a community organization, and also networking. We have to work closely with the government, which is in charge of developing policies, which in planification, strategies, guidelines, and assessment. With the for-profit organization, we will do consultation, we will contribute to capacity building, we will contribute to coaching and mentorship. With the community organization, we will do micro-planning, we will implement innovative initiatives, and we will learn from implementing activities in order to foster our accompaniment to the government initiatives. Also, as you know, today world is where we can't work alone. We have to be in a network, and we'll use that. And I think that this opportunity at the AIU symposium is an opportunity to build that such a network in order to contribute to the community initiative, to contribute to the for-profit initiative, all that to support the government initiative and policies. And all that is to contribute to sustainable development goals by 2030. Slide, please. Okay, so here that is what I was developing with the previous figure. With the no-profit organization, I will support organization in low and middle income countries in developing and implementing innovative approaches, implementing programs, in advocacy for change in policies and government for vulnerable population for better life. With the profit organization, we will develop sustainable program. We will develop capacity building for evaluation forms, and also for monitoring and evaluation program. And using the network, we will train individuals on subject which will leverage on development, and we share and discuss on important subjects. Slide, please.
Mr.
Slides.
Modi, can you please mute your phone, Mr. Modi, your line, the computer?
Please.
Mr. Modi needs to mute his line.
Okay, thank you very much. As an action I plan to do, following the goal 1, I will continue to fight against COVID-19, tuberculosis, malaria, and HIV by raising awareness on prevention, by supporting treatment and care, by supporting innovative and effective strategies and development. Slides. About the goal 3, which is good health and well-being, will contribute to strengthen maternal, child, and vulnerable population health program by contributing to advocacy policy development for resilient and sustainable health system, by contributing to the design, implementing, and evaluating sustainable health program, and by contributing to stakeholders' capacity building and strengthening. Slide. Slide. Okay. About the goal 4, which is equity education, I plan to contribute to strengthen social and reproductive health for adolescents and young girls by contributing to advocacy, policies development for resilient and sustainable sexual and reproductive health right programs, by contributing to the design, implementing and evaluation sexual and reproductive health and right program, by contributing to stakeholders' capacity building and strengthening. Right? And also, I will about the goal 8, which is decent work and economic growth. I will contribute to that by employing staff members for business, but also employing community members to develop community health for community in my area or intervention. Slides. I will also contribute to reduce inequities by contributing to reduce inequality within and among countries, as I will contribute to equitable access for health services for all vulnerable population wherever and whenever and wherever within each country. But also, I'm based in Burkina Faso, but I plan to support other countries in order to ensure equitable access to health services for all vulnerable population worldwide. Okay, what are the area of expertise for profit organization? We work on public health program design, monitoring and evaluation design and implementation, data management, training, learning, mentorship, and coaching. Slides. This picture is an offer for training for community workers. Yes, this one is an offer for communities. Okay, and for no-profit organization, we plan to contribute to social and health improvement in Burkina Faso through the delivery of healthcare, the delivery of prevention services. Will contribute to raise awareness, community-based distribution of health supplies, such as condoms, and also social and economic support for vulnerable population. And also, will contribute to young people education and capacity building in Burkina Faso through supporting people and student learning, ongoing learning for adults, reduce illiteracy among adults in our country, and also will contribute to environmental education. Slide. Also, with the third tool we have, which is networking, we will continue to leverage on important subjects through mentorship, coaching, conference, partnership, and networking. As today, when we want to change something in a global way, we have to work together in a networking based. Slide. What are our opportunities for us? The first opportunity for us, in order to achieve our innovative idea, the offer by AIU create website. That is an opportunity for us to create our website and to show what we are doing and what we are capable to do to support the Sustainable Development Goals. Also, an opportunity like this one, the symposium, is also an opportunity for us to share our idea, have suggestions and recommendations in order to improve the effectiveness for impact in our world. And who knows, maybe there are another opportunity ready to take them in order to take in my idea. Slide, please. What are challenges? Challenges is will be like for any new organization, and as we are a new organization, we have a new team, and we lack experience. And I said that we have the challenge is how to build the capacities of my team, and also how to found resources to implement what we have planned to do. And also, if you are a new organization, means that you don't trust in you. They need you to do things in order to they will see, and then they will trust in you. That is something we are doing to show that we are able to change things at local level, and why not at world level, at global level. I mean, slide. Report on action. What have we done so far? We have a legal existence. We have an office. We have a staff, even it is just one person by now, and we have volunteers ready to work to raise awareness on important subjects. And so we have already applied for a request for proposal, and hope it will be fruitful in a couple of days. Next slide. What we plan to do is to develop the website by December 2022, and we will update our action plan, and why not implement them in what does not request important resources that we can bring. We have also to reinforce our equipment. We are going to create awareness on malaria, sexual and reproductive health, COVID-19, and immunization. We are going to apply for request for proposals. We have already started to pledge for access for immunization services in security communities. We have also planned to develop a learning platform on universal health coverage in order to support our country. We are also plan to develop a supportive platform for mentorship and coaching by December 2023. And also, why not turn our association to a foundation by December 2030. Next slide, please. As a conclusion, Dr. Valsin, Dr. Lambert, and everyone, I will say that the early decade, 2021-2030, is marked by numerous new health challenges, such as COVID-19 and monkeypox, with their impact on economics, social development. To these challenges, there are the former challenges such as malaria, tuberculosis, HIV, and maternal and child mortality and morbidity, particularly in Africa. Also, in West Africa, we have, and Western and Central Africa, there are also terrorism compromising health program implementing. And for all that reason, we need innovative approaches as AIU are suggesting us to do to deal with all these challenges in order to achieve a sustainable development goal in that part of the world. So implementing skills required from AIU is the way for me to accelerate my personal and potential professional growth. And I do believe that only effective collaboration between public, private, and community sector can lead to impactful intervention. Next slide, please. Here you can see the Sustainable Development Goal, the 17th. And I am based in Burkina Faso, in the US. And I think that from this country, from resources from this country, we can support all Africa to achieve the sustainable development goals in that part of the world. And once again, I will say muchas gracias to all of you. Thank you very much. Dear Dr. Valsin, dear Dr. Lambert, thank you. That is what I wanted to present.
Thank you very much, Dr. Boureima Kabore from Burkina Faso. That was the first presentation for our symposium this year on the topic of innovative ideas. Dr. Kabore emphasized particularly the Sustainable Development Goals of the United Nations. And of course, one of the most important ideas that I retained from the presenter is the goal to reduce inequities in every single aspect of life, whether education, health, economic growth, and so forth and so on, you name it. And Dr. Kabore concluded by also making mention of the specific strategies that could be used to attain that goal of reducing inequities. The last conclusion from the presenter was that there is a way to go for that kind of sustainable goal, whether in Africa, in Burkina Faso, or anywhere else in the world, to have effective collaboration between all stakeholders that can be involved from the government side or from the private sector side. But those were the ideas of Dr. Boureima Kabore from Burkina Faso, and I very highly commend you for an outstanding presentation. I commend you for that. I congratulate you. You've done a truly superb job, Dr. Kabore. But now it's your turn, ladies and gentlemen, our attendees for this symposium. It's time for you to ask your questions, and all you have to do is go to the bottom of your screen where there is an icon to raise your hand, and we will single you out to come up with your idea and ask your questions. We will begin, of course, with Alhaji Boureima. Alhaji Boureima, you may go ahead with your question. Please turn your microphone on, and it's your turn.
Thank you very much, Dr. Vassi. I'm Alhaji Boureima Kabore, a doctorate student at the AIU, School of Social and Humanities, majoring in humanities. I've just concluded, of course, my course, waiting for graduation in August.
Let me interrupt you for just a quick second. Let me ask Dr. Kabore to turn off the presentation, or Felipe, if you can do that on your end so that we can see all the hands up. Thank you very much. Go ahead, Heidi.
Yeah, thank you very much, Doctor. I want to take this opportunity to thank Dr. Kabore for a fantastic, a remarkable, a very brilliant presentation on the innovative ideas. And also thank the Atlantic International University for providing this platform such that we'll be able to have all of these ideas put together moving forward. And as I've said, I am a researcher. I'm quite interested. I'm a researcher, an academic, and I'm here. I'm a Sierra Leonean. What I want to do is maybe to ask Dr. Kabore and all other colleagues for us to ensure that we create a network to be able to be working on issues of this nature, because these are issues that affect right across the globe, especially for us in sub-Saharan Africa. In Sierra Leone, for example, issues of maternal mortality, issues of reproductive health challenges. So I want to call on Dr. Kabore specifically and other colleagues for us to share our numbers, email, and create a network so that we'll be able to share ideas and work on issues of this nature for our individual countries and for Africa at large. I want to tell Dr. Kabore a very big thank you again, and AIU for providing this type of platform. Thank you.
Dr. Kabore, any comment or answer to Alhaji's question?
Thank you very much, Dr. Boureima. I think that it's my my homonym when we call in French. Yeah, I thank you for his brilliant suggestion. It will be important for us to work in network, and that is what I have suggest in my initiative, because today, if you want to succeed, you have to work in a context of networking. That is really important. I think that is an important suggestion he has done, and I thank him very much for that.
Thank you very much for your response. And again, pretty much the concept of networking is one that we should focus on very, very closely, because there is absolutely nothing that we will be able to achieve if we are functioning or working alone. We've got to network with other professionals, pretty much in that line of idea from Alhaji and confirmed by Dr. Boureima Kabore. When we connect to other people from every single walk of life, we'll be able not only to share ideas, share whatever resources we have available on our hands, but also we can gain both the knowledge and the
Dr. Marcin?
Fue el audio, Dr. Franklin.
I don't know how it happened. I use a shortcut to either turn my microphone on or off. I don't touch the keyboard. I have my hands free. I'm a lover of shortcuts when it comes to computer technology. So I don't know how it happened, and I apologize to everybody, to all our attendees. What I was saying in substance was that the concept of networking is one that we should cling on because there is absolutely nothing that we can achieve if we are operating or functioning alone. We need to share whether the knowledge or the resources with other people to gain access to that vast, humongous amount of knowledge available out there, and also the resources that other people, other communities have. And if we network, since we are giving, then people won't have any problem at all to give us as well. So it's a give and take process that's going to take place. Thank you very much for your question, Alhaji, and also your response, Dr. Boureima Kabore, but we are now moving to Salako Adebayo for your question. Salako, your microphone is off, Salako. Your mic, please turn it on. Adebayo. There we go.
Okay, thank you very much, sir. I'm very happy that I'm part of this program. But since I've been listening to the presenter, first and foremost, I want to congratulate the presenter for this wonderful presentation. But I cannot deduce categorically whether this study is an experimental study or an experimental study. I've been expecting the presenter to dwell much on the methodology, because this, for example, if another person wants to carry out the same research, this design, the result design or the method the researcher has adopted will go a long way to help anybody that wants to dwell in this type of research. That is my observation. Thank you very much.
Thank you very much, Salako. I don't know if you have a comment, Dr. Kabore.
Okay, thank you very much, Dr. Adebayo, for the observation. I think that that is not really a study. Not a study. This is an idea. What I think that we have to develop a private organization and collaborate and work closely with a community organization and work with other experts worldwide, because we can learn from each other in order to leverage the effectiveness of your activities. So I have created a private organization. I have also a community organization. The community organization is working with the community at social level, developing small program based on people needs at community level, and try to find resources to implement innovative activities in order to be most effective. And also, when people like consultants work and learn from community-based organization, they are most effective because the knowledge is based on what is real at the lowest level of the community. So we can have a change to have effective program. But if there are consultants which do not know what is done at the base, but they are expert here, they want to show, okay, you can do it, you must do this, you must do that. But when you finish your planning and you go to implement them, most of the time it is impossible because there are some parameters you have not taken into account. So that is just an innovative idea, just to suggest that the government must work with private organizations, work with community organizations, but all of that, we need to build a network of knowledge, of experience, in order to be most effective. That is the objective of this work. It is not a study.
All right, thank you for this clarification, Dr. Kabore. It is very important that our attendees get into this concept that it's not necessarily a project or a research activity. We are talking about innovative ideas, which can be in any area or field of life. It doesn't have to be an academic research. The goal pretty much within that same token of ideas from Dr. Kabore was that we develop some type of strategies to reduce inequities in every single aspect of life, education, health, or other dimensions of life, as long as we keep networking with each other, we share resources, knowledge, and everything. This is one very possible, effective, efficient way that we can achieve that goal to reduce inequities. Thank you very much for your response, Dr. Kabore. Thank you also for your question, Alan Salako, Dr. Salako Adibayo. I want to remind everybody that you are following or attending a new symposium of Atlantic International University on the topic of innovative ideas. Whatever you have that you can think of in terms of what you can do to make sure that the new generations profit from the new paradigms, because they cannot accommodate all systems that are getting completely obsolete, outdated. Whatever it is that you can do, it is within this topic of innovative ideas, this new symposium of AIU. Once again, welcome to everybody. I want to apologize anyway for the fact that Dr. Boureima Kabore from Burkina Faso could not, for whatever reason, turn his camera on, so we couldn't see his face, but I assume that everybody would agree with me that his presentation was truly outstanding. But we are moving along with other questions, and now we are giving the floor to Alanyo Mali. Alanyo, go ahead. I no longer see Alanyo Moyi's hand up, so we are moving to the next attendee in line, that is Felton Yayen. Go ahead, Felton, we're waiting for your question.
Good afternoon, good morning. Hope everyone is doing well. This is Felton Yayen, student of the AIU, focusing on innovation from business and economics school. Would like to. Hello, there's noise in the background.
Okay, we would like to ask Chris Mirabo Jetro. Well, his microphone is off now, so go ahead, Felton.
I would like to thank the presenter, Kabore. He's provided a very innovative aspect from his field of study. Being an innovator myself, I'm actually moving through of what he presented about the African perspective. I think these are issues in the health sector that affects Africa, and presenting his idea on innovation, how we as innovator could look at scaling up on the designs. I was thinking in the context where he looks at the private sector, because he said public and private sector. I was looking in the private sector. What are those innovative technology that could applied, for his idea? Is he considering using any of these machine artificial intelligence or machine learning tools as a means of leveraging the issues of health provision in the private sector? Because as is, public sector is dependent wholly on government, and in Africa, government are not as is in the West. Government looks to resources that are not adequately meeting the needs of the people in terms of health and education. But if it comes to health, what are the technological aspect of your innovation? What do you intend? Which of this machine learning tool or artificial intelligence you think necessary that the private sector can leverage to meeting the SDGs? That's my question. And I say, like I said on the beginning, I want to thank you ever so much for presenting the African perspective, because as I just said here, I was visiting one of the clinical maternity center this morning, and I saw the need that there are so much that needs to be done in this sector, not just to present, not to know that this symposium was going to present actually your findings. So I want to thank you truly for that, and let's see what much not the public, but the private sector can do in terms of technology. Thank you.
Dr. Kabore.
Okay, thank you very much, Dr. Felton. I think. Okay. Can you hear me?
Yes, we can hear you.
Yes, we hear you.
Yes, I want to thank Dr. Felton for his question, and assure him that when I'm talking about private organization, that is true. It includes also artificial intelligence, as nowadays as health information system. When we talk about health information system, we are talking about digitalization. And when we talk about digitalization, means that you have to talk about, we have to use new technology for information and communication, and that is true. But most of the time, there are some great organization, maybe based on the US or in Europe, delivering this kind of support. But even you are a small organization at local level, you can do something in order to support the government, because I'm sure you cannot make what can I say? We cannot make a big machine, but you can develop some tools based on what you can do in order to support as a private sector. Nowadays, I'm trying to develop a platform in order to train people remotely. That will be something I can do in order to collaborate with the government, because instead of going to travel and go to train some people, we can organize the platform and train people through that kind of platform. That will be something as a private organization collaborating with the public organization. And also we can support community workers on how to collect data and how to analyze data at their level, how to improve the quality of the services, how to improve the quality of the data they are producing. So I think that that is really, thank you for your idea. When we talk about private we are talking about a new technology of information and communication.
Thank you very much, Dr. Kabore. We have about 5 minutes for more questions for Dr. Kabore before we jump into the second presentation on schedule. But now we are going to Julius NT for his question to Dr. Kabore. Julius?
Thank you, Dr. Frank, and thanks to all the participants and especially to the presenter. It was really an interesting presentation pointing out the real life issues. I am Julius, and an aspiring student of AIU. I think I got engaged with the university 2 days ago and struggling or pushing on with the admission procedures. I don't have a direct question to the presentation, but I could have a question to the administration. I don't know if this is the right time or it is still on your agenda, because I joined about 4 minutes late, and I'm not sure if my desires about joining the university, those who are in charge, are on your agenda, or I can post it now.
Thank you very much for your comment and your idea, Julius NT. I'm assuming that you could post this comment onto the chat section of this presentation, of this symposium, and Dr. Lambert or some other authorities of AIU will be very pleased and delighted to address the issue that you are trying to bring up. Thank you very much anyway. Your attendance is of great value to all Atlantic International University family. Thank you very much. Shepherd, RSA, for your question. Even if there is no camera, but go ahead, Shepherd.
Oh, thank you very much, Dr. Wilson. Thank you very much. Thank you very much. I'm a bit in the dark here, but it doesn't matter. Yes, thank you so much for this platform. I really garnered a lot of knowledge and wisdom, and thank you to Dr. Kabore. Wonderful presentation, as everybody has said. But it was a bit fast in the beginning. I think I picked something about lowest school completion rate in Africa, sub-Saharan Africa. Lowest school completion rate. Apart from poverty, what could be the other factors causing that? Because not everyone is so poor. Some people they can afford, but still there is a lowest.
Noel Chirenje, we're getting some feedback from your micro. All right, thank you. You turned it off. Thank you very much. Go ahead, Shepherd.
Yes, thank you very much. So, yeah, that's my question. Apart from poverty, what could be the other factors causing this lowest school completion rate in sub-Saharan Africa, Dr. Kabore?
All right, Dr. Kabore, you have an answer?
Because of the low coverage of COVID-19 vaccine, or I have not get the question.
No, the question was essentially about what could explain the low rate of school completion in that part of Africa.
Yes.
Sure. I think that there are many causes on that. What I wanted to show, maybe it's not the right graph. What I wanted to show is that because of pregnant female teenagers, female school. What can I say? Yes, girls they leave school because of pregnant. And
Teen pregnancy, right? Teen pregnancy.
Yeah. So we want to improve the capacity to avoid that. Mm-hmm. If not, the reason of low access to school, low access to school is that maybe there is lack of teachers. That is one of the causes. The other, because in remote area, most of the time they lack teachers, mathematics or science teacher, something like this. So it is important. It is difficult for them to complete the school. Also, because of homework, most of the time, girls have many things to do at home, so that they can really correctly attend at classes. That is something also contribute to the low rate of, yeah. That's something like this. And
Thank
also
you.
there are, even today, there are many villages where there is no school. There is no school there. So we need to have schools near every people in order to help them complete the courses. There are many courses like this. I think that it is not all.
Yes, one.
Yes, that some of this.
All right, thank you very much, Dr. Kabore. It's very, very unfortunate that I see multiple hands up at this time, but as you can understand, we have an agenda that we need to follow. We have several presentations on our agenda, our schedule for this symposium, and we unfortunately cannot accommodate all the questions that I understand you would like to ask Dr. Kabore. But of course, there is an option as well to post your questions on the chat line. There is a chat screen where you can post your questions. And either Dr. Kabore, who's going to be around until the end of this symposium, myself, Dr. Lambert, or other AIU officials who are actually in attendance at this time can spot your questions within the chat line and we'll respond accordingly. So I want to thank you. I want to thank you very much for this understanding. You understand time is, a very precious commodity, and we have several presentations on this schedule, and of course it would be kind of cheating out of this opportunity to present to other presenters. And thank you very much, our attendees, for your understanding of this issue. And congratulations once again, Dr. Boureima Kabore, Doctor of Public Health in Burkina Faso, for your superb, outstanding presentation. You've done so well that many attendees still would like to, get a hang on you and ask you several questions. But of course, let me remind our attendees that the chat line continues to be available if you want to post your questions. As a matter of fact, it's going to be an appropriate channel since you can ask your questions in whatever length you choose. And Dr. Kabore will certainly enjoy writing answers to you. Thank you very much again. Thank you very much, Dr. Kabore. And we are moving